Good afternoon, everyone. Thanks for coming to the West Winds campus today. This is one of many announcements that has been made as we roll out transformation of crisis service delivery to vulnerable Calgarians. Today is a specifically momentous occasion. We're joined by three guests that I'd like to introduce now. Chief of Police Mark Neufeld, Mayor Jyoti Gondek, and the CEO of the Alex Community Health Centre, Ms. Joy Bowen-Eyre. I'd now like to introduce Chief Neufeld to come up and say a few words. Chief?
Well, I have to say, it's without question, it's been since before COVID that I've seen this many people in this room, so that's nice to see once again. And as Superintendent Rashid has said, it's actually a really, really momentous day. This is actually really exciting. Thank you for attending. We're here today to announce an exciting new partnership initiative that will further evolve and enhance the crisis response model here in our city. Back in 2020, we heard our community when they told us they wanted to see a crisis response model expand to include non-police options in cases where that was possible. At the same time, our own employees were telling us that they were responding to an escalating number of dispatch calls that were better suited to response by health, addictions, and social service providers. We recognize that uniformed police officers aren't always the best option for those experiencing a mental health or addictions crisis. However, police have become the default response for those in the community, particularly outside of regular business hours and into the weekends. Since 2020, we've been working, we have set to work to establish partnerships, including with the City of Calgary under the banner of the Community Safety Investment Framework, otherwise known as CSIF. And some of our work to date in this regard includes, in partnership with the Alberta Health Services, we've substantially increased the capacity of our police and crisis teams, or PACT as you may have come to know them, which sees a police officer partnered with a crisis worker co-responding to calls involving mental health crises and individuals in addiction. In partnership with the Alpha House Society, we've increased capacity for the Downtown Outreach and Addictions Partnership, or DOPE, which sees community teams respond to calls downtown and on transit involving individuals who are unhoused, vulnerable, and those with complex social and medical needs. In partnership with Calgary 911 and the Distress Centre, we've launched the 211-911 co-location initiative, which creates opportunities to divert non-emergency calls to alternative community resources. Today, we're announcing a further partnership with the Alex, as well as Calgary 911 and the Distress Centre, to launch a one-year pilot project involving a community mobile crisis program in East Calgary. The goal is to integrate all elements of the crisis response ecosystem so that calls can transition seamlessly between service providers as necessary to ensure we get the right response to the right people at the right time and in the right location to make the most of that response and to have the greatest possible impact that we can have. During the first phase of the pilot, the Calgary Police Service will provide sworn members to support the mobile crisis response teams. But of course, how that looks as the pilot continues will depend on our experiences as we go. The partnership adds a new dimension, community responders, to the existing suite of crisis response supports. The goal, of course, is to empower the Alex to respond as necessary to focus on mental health and addiction calls, while at the same time freeing up police resources to respond to those events where those are most needed. We're thrilled to be taking this further and additional step in the evolution of our crisis response model here in Calgary. We are pleased to partner with the Alex, the City, Alberta Health Services, Alpha House, Calgary 911, and the Distress Centre. We'll continue those partnerships as we continue to prioritize the needs of Calgarians and enhance not only crisis response, but community safety more generally here in our city. With that, I'm going to hand you over to Mayor Gondek.
Thanks very much, Chief. Let me tell you a little bit about the Community Safety Investment Framework. This was approved in 2020, and it combines funding from both the City of Calgary and the Calgary Police Service with a goal of transforming Calgary's ability to respond to people who are experiencing crisis. The need for a community mobile crisis response pilot program comes from a research report that was conducted to assess Calgary's current crisis response system. One of the identified gaps was the need to incorporate peer support as well as a diverse and multidisciplinary approach to provide immediate resources to those experiencing crisis, their families, their friends, and members of the community around them. So why does this matter? Investment in the Community Mobile Crisis Response Pilot Program allows us the opportunity to transform how Calgarians are supported during a period of crisis, how we can reduce call demand, and how we can work with experienced community members who are equipped to respond to Calgarians experiencing a crisis. The Community Mobile Crisis Response Pilot is designed to fill existing gaps in Calgary's current crisis response model by providing an alternative to those in need of urgent support due to a non-emergency mental or emotional distress or conflict. By coordinating and collaborating across community, throughout governments, the nonprofit and business sectors, we are building a community where collaboration connects Calgarians to the resources and services that can best support them. Our role in the Community Mobile Crisis Response Pilot Program, the Community Safety Investment Framework, and our overarching guide, which is the Mental Health and Addiction Strategy, is by acting as an investor, a convener, and a partner. We are trying to find all the ways in which we can build, invest, support, and guide community to support the well-being of all Calgarians. And to tell you more about that, let me welcome Joy Bowen-Eyre from the Alex.
Good afternoon. Thank you, Mayor Gondak and Chief Neufeld, for your leadership on delivering a commitment to the city in addressing existing gaps in the crisis response system. We are honored and excited to collaborate together to co-create a community-based solution. We believe the Community Mobile Crisis Response Program will serve to reduce existing barriers and systemic stigma often associated with crisis response. We will provide a service that is trauma-informed, equity-based, and person-centered, ensuring that calls with a mental health focus are addressed by those who are appropriately trained to respond. Our colleagues at the Distress Centre in 211 will facilitate the dispatch of the Alex Community Mobile Crisis Response Team to respond to non-emergency crisis calls. The team will provide voluntary care, immediate crisis management, assessment, and referrals to community-based organizations according to immediate need. Case managers will facilitate continued connection post-crisis to ensure longer-term needs are addressed, including a connection to our very own primary health care and social support programs at the Alex Community Health Centre. The Alex's Community Mobile Crisis Response Team will consist of people with professional backgrounds and/or lived experience. They will complete a robust training program, which was informed through consultation with other community health centres who are also supporting crisis-based response in other jurisdictions across Canada. Training will include crisis mental health and de-escalation, first aid, naloxone administration, suicide intervention, crisis intervention, trauma-informed care, 211 dispatch, Indigenous awareness, and gender and sexual diversity training. The Alex Community Health Centre provides wraparound health care, housing, social, and wellness program to Calgary's most vulnerable citizens. We have 5 decades of experience innovating and working in the community, and we know that we have a reputation for tackling tough health and social issues by walking alongside people on their journey from crisis to wellness and from challenge to change. We are confident that together with our community partners and leadership from the Calgary Police Service and the City of Calgary, that we can support persons in crisis, providing the right response at the right time. I'll now pass it back to Superintendent Rashid.
Thank you, Ms. Bowen-Eyre. So that concludes the official part of the announcement. I'm happy to take any questions and refer them to any of the subject matter experts either here or we have some scattered throughout the audience as well. Sure, and then I'll identify the best spokes individual to respond to those.
I'm calling the CBC. I have a lot of questions, but I'll just take my turn. So first of all, just overview. So what will this look like? So if you're getting a call in, sort of what kind of response would happen? I know it varies, but whatever wants to know.
Chief, do you want to start?
I can certainly start. I'll start from our end, Colleen. Thank you very much. I mean, obviously, the 211 co-location into 911 would identify calls of the mental health variety where there wouldn't be any indication of weapons or immediate danger that would actually sort of tip it into a police call. But certainly there's lots of calls that come in where that is not the case, and that would be the kind of call that would be diverted through 211 over to the community responders. So those would be the resources that would go to respond to those types of calls.
And so, so it's running 24/7, so what kind of staff are you looking at? Do you have to add a bunch of staff, or?
Thanks, Colleen. So the Alex currently offers mobile response and outreach services right now, and so we are comprised of integrated care. What integrated care looks like for us is we have physicians, we have nurses, social workers, psychologists. It's a full wraparound care support team. We were working directly with the police to determine what the best type of supports will be required. Initially, we will be partnered with police officers to respond initially for the first few months. What we will do is we will seek to adapt and tweak as we go, depending on the cases that we are referred to.
And how do you see this changing for what happens right now?
So I will let Police Chief talk to exactly what happens right now, and then we can talk about what happens in the future. Thank you.
Yeah, for me, this is a fundamental change. As I said, we've got members actually responding to calls, particularly after hours and on the weekends, where the resource that people require is a mental health or addictions counseling or some, it can be a complex or there's a number of complex needs out there which require multiple resources. But the police in that case go there and they're actually really just a referral system. And so if we go at 3 o'clock in the morning, the hope is we'll make a referral and say, you ought to follow up with this agency or that. But the reality of it is people don't always. And so I think what we see is people, the police may go there, they may be able to calm the situation for a short period of time, but that's not the ultimate solution to the problem or the ultimate resource. So I think if you were to be able to track the number of people that actually make those connections that actually would be helpful, I don't think it's as good as it should be. Whereas when we can send mental health resources at the time, and the beauty, I think, of the Alex, particularly in East Calgary, is they've been there for so long and they're networked within the community, they know the community, so who better to send as the first response in those type of cases, so people are connected now. When we talk about having a kind of an integrated case response and ongoing case management, there can be a connection between the first call and the second and the third type thing. But hopefully the goal would be to keep people from getting into crisis to the point that the police have to be called because the situation has now become dangerous. As we've heard in many fatality inquiries and this type of thing where situations have been allowed to fester and folks, I suppose, fell between the cracks is the words that are often used. And I think that's the point. We're blessed in Calgary to have as many resources as we do. It's just that we have, all these resources and all this need. But the problem is at 3 o'clock in the morning, we sometimes aren't making that connection. So I think that's going to be the fundamental change here that we're going to see.
So before we move along, I'll just check with our partners at Calgary 911 at the Distress Centre, see if you wanted to add anything to the comments the Chief has provided about the call intake triage, if you're able to, Linda. Sorry.
Take your time, Glenn.
And the reason I think this is important, I'm making Glenda walk all the way across the room, is because the call intake, triage, and referral piece really starts at the Calgary 911 Centre, so hopefully Commander Salem can provide some guidance around that.
Thank you, Superintendent. Hi, everybody. I would like to re-emphasize the connections and partnerships that have brought us here today, connecting citizens with mobile outreach teams. Our overarching objective has always been identifying and implementing new ways to respond to non-emergency mental health and other 211 service-related calls with the goal of improving the outcomes for Calgarians. Calgary 911 is for emergencies and 211 is for social-related guidance that may include resourcing for mental health, housing, addiction, and other social supports. One of our goals has also been to take the stigma out of that, take the stigma out of poverty or homelessness or mental health issues. And we are co-located now. We have 211 working in our 911 Operations Center 24/7, and we're learning from each other every day. And we're seeing the transfer and the connection numbers from 911 that may initially have gone to the Calgary Police Service, now being transferred and connected with 211 and the DOPE team downtown.
So would this be like an extension to 211, having another system like the one announced today? Is that kind of like the brain?
I would describe it as an enhancement, but I'll turn it over to Joy.
As would I would describe it as an enhancement, and we would be dispatched from our friends at 911 and 211. And so when we talk about the right team for the right response, that's what we're talking about. We will be heavily relying on our 911 and 211 to ensure that our team is designated out to the right response.
So while police accompany support workers with that, are they going to be in plain clothes, and how does that affect the caller's ability to make that phone call? And if something illegal is found or happening at that call, what's the police to do in that scenario?
So I'll start, and I'll kick it over to Chief Neufeld. So initially, when we would go out to the call, if it's deemed appropriate for the Alex's Mobile Crisis Response Team, we'll go out there. It'll be our team along with a plainclothes police officer who's supporting, because initially this is transformational, not just for our team and not just for the police, but also for the community as well. So it's important that the community gets used to a new response. And so initially it would be the team goes up together, and if it's appropriate for the entire team to go in and respond, that's what will happen. If it's determined that now all of a sudden that there's a safety involvement for the folks inside the home as well as our teams, the police will be the primary responders. If it's deemed that there is no weapons involved and it's safe for our team to go in, then our team will go in first. And so when we talk about a pilot, what we're talking about, we need to figure it out together and co-create and co-design this together, because this will be a first for the city of Calgary about how we do this response. And so I think there's going to be lots of learnings and lots of opportunities as we navigate this together. I think the bonus of community being a partner there is, as Chief Neufeld eloquently said, is the Alex has been in East Calgary for quite some time. We have immense partnerships. We know many of the folks who live in those areas. Our main site is located in East Calgary. Our community food center is located there, as well as 2 of our housing buildings. And so we also have really excellent relationships with other community partners, such as Alpha House and our friends at the DOPE team. If we get to a call where it's deemed that we need the support of the DOPE team, then our team will be in contact with the DOPE team. And so what we're doing is creating networks and partnerships for the individuals. And so it goes back to that right response at the right time. Chief?
Thanks, Joy. The one thing I would just add, I think, is that I think the beauty of this partnership and the way that we're actually constructing it now is that it would be very easy to actually operate in silos, but I think everybody here knows that's some of the problem with why we have some of the difficulties that we have now. So the idea that we're looking to send the right resource, but at the same time, some calls come in and it's very obvious that that would be a call for the mobile crisis responders. Other ones, with the information that comes in, it's pretty obvious that it would be a call for the police. But there's a large number of calls that are actually, you can't tell. Sometimes you get a call and you get a 911 hang-up where somebody says they need help or whatever. You don't know. So I think the key for us is to try to create a system where we all work together within the system, putting the person at the center of it, and then having the resources work together. So if the crisis responders are dispatched to a call, which in and of itself is pretty special, I think, being able to dispatch crisis responders from the community through Calgary 911 and through 211, I think that's pretty special. But if they go to a call and they get there and they find that the situation wasn't exactly as it was reported, or it's changed in the time that they were responding, there will be easy pathways for contacting the police to say, okay, I think this is a police call. And conversely, there'll be times the police will go to a call and they may get there and they may say, this is a perfect call for the community crisis responders, and they can easily transition. So in the beginning, as Joy says, we'll have police officers in plain clothes, and that's that piece about trying not to attach the stigma to folks when we respond. And then we'll just figure it out. I think we know a lot of things about what we do know, but as we do this, there's that stepwise process about figuring out what we do know and how best to roll this out. So I think the model moving forward together is way better than one where you say we're going to move forward in isolation, because it's a lot harder, I think, to sort of knit together that ecosystem. And I think that's something that's been missing. That integration has been missing for a while.
Can I ask about some clarity about what that threat to safety would be? Would that be public safety or the safety of the individual? Because I think of that situation in 2015. There was a gentleman, Alex Heffernan, in a hotel room. He was on drugs, but he had a syringe that he was using the drugs with. And it seems like that would be a situation where this would be
It could be. That's a great reference, actually, and it could well be. I think it depends what information comes in the beginning and how that call is evaluated through 911 and 211. And we know that sometimes things can escalate, and the point is, and the training, as Joy spoke about, is to de-escalate. And I think just to actually speak, and because I think I forgot to address the part of your question before about what would be the role of police when we accompany the crisis responders. And when police go to these types of calls, mental health type calls, they use a tremendous amount of discretion to try to keep it out of the criminal justice system. So if somebody's threatening harm to themselves, as an example, they certainly wouldn't be looking to lay charges or whatever, even if somebody was in possession of some type of a weapon. I think where it can escalate is if there's an assault on perhaps a neighbor or somebody on the street or whatever, it becomes a criminal matter. But the police use a tremendous amount of discretion to keep a medical issue in the medical system and to keep it out of the criminal justice system.
Can you speak on the drug possession side of things too? If police were to go and see, a bunch of stuff there, how do we separate that from the fear of a caller who might have something with them, but calling to save their life rather than to get in trouble?
Yeah, and I think the key is the calls don't necessarily always come from the individual themselves. So that's probably one of the features of these. Some do, but other ones don't. And so I think if somebody was addicted or had some sort of controlled substances or whatever, there may be a barrier for them to call. But let's face it, sometimes it's other third parties that end up calling. And again, when the police come, if you have a small amount of a controlled substance and it's somebody who's clearly addicted, nobody's looking at charging that person, putting them into the criminal system. So again, where discretion can be used, it is, and it's used heavily.
Could you speak to this policy, it's just in District 4 for the first year. Why was District 4 chosen and why not other areas as well?
So I think I'll just take a swing at this and then somebody else might want to, but looking at the data, District 4 was identified as an area of the city when we look at mental health calls. It doesn't have the most, but it doesn't have the least, so it's about middle of the road. Also, it seemed like that was a great fit for the ALEC because that, as Joy has said, that's where they're headquartered, that's where they've got a number of network of relationships, and also very familiar with working with District 4 members out there. So it seemed like a great place to start. If you're looking for a spot to sort of set up a pilot program for success, this seemed to be a good place to do it. And again, it's one of those things, rather than jump in with both feet, we've got some pilot projects going in the downtown with DOPE, and then to say, okay, let's look at what we would be able to do with these type of interventions in one particular district. Let's see what works as a result of that, and then we'll learn from that and scale up as we need to, if appropriate.
It might be a little bit too early, but I mean, it was only a few months when you were at the podium talking about the 211, 911 program. How are we seeing that? Like, has there been a load off of the district officers now seeing that relationship, and now again this new enhancement? Is that part of this whole thing? Is to have that load taken off the district officers?
Yeah, I think there's a two-pronged sort of benefit there. The one is, yes, it diverts calls for service away from the police service. So in cases where, again, it's non-emergent and it wouldn't need to be the police aren't being the default responders because, of course, officers have other calls on the board, more than ever, actually. And so that's really valuable. And at the same time, I think we're getting, again, that right service to the right folks at the right time. And I know we have folks from Robin from 211 here or Glenda that could speak to what they're seeing because they're in there doing it every day. And I think that's another example, Robin, learning as you go and not knowing what you don't know when you start, and then finding that develop along the way.
Hello, everyone. Oh, good to see you again. I was joking earlier, we need to have Glenda cry. But I think, to me, that speaks to the essence of what we're doing, to even have all of us up here have that emotional illicit reaction when we talk about transforming how we support people in our community. I think what's been really special for us with this at Distress Center, and super excited with our work the last couple of months with being able to connect into the DOPE team and coming up the team at the ALEX, there are hundreds of other programs and services that are available in our city for Calgarians in a crisis. And so our role at 211 is really to spend that time connecting with someone to dig into what are those needs, and often what are those underlying needs that have led to a call to 911. Because we often know that what precipitated that call is not only what needs to be addressed. I think in the last media we talked about that iceberg and all of those underlying issues, and we're able to work to get connected into community and to do those follow-up calls, so to connect back with people to ensure that they were able to get the help and support that they needed. And so while it does take some of that pressure off some of our systems that are feeling overloaded, for us it's really about how do we make sure that people in our community are connected so that they can move from surviving to thriving within the community and become part of what this great city really does have to offer. So really excited to get to see the next enhancement and the next evolution. And hopefully we're back here in a few months again talking about what we've been able to see and how we've been able to continue growing and transforming how we respond to those in crisis.
Just a bit further on that. Is the public at a place right now where they can distinguish between 211 and 911? Have they made that differentiation? And will this help make that a bit more distinguished?
I think so. I think we're getting there. Everyone learns about 911. I remember sitting on a gymnasium floor. I think I was in kindergarten, grade 1. And if you have an emergency, if there's anything going on, call 911. Our newcomers to Canada, when they're coming in, they learn about 911. So another side of this that we've been doing is really trying to provide that public education as well. So it's about getting calls that are coming to 911 that would be better suited with community to 211. But how do we continue to work with our community members and educate that they can just call 211 directly, that it doesn't even have to go through that route. And one of the things that we've seen a really great success with that is with our connections to the DOPE team and that community education, and seeing more and more community members just call 211 directly to get connected with the services of the DOPE team.
And so have you seen, has the call volume gone up over the 2 months, would you say?
It has, yes. And so our volume in August, we made 289 total connections to the DOPE team. In September, that was 346 total connections to the DOPE team. So we are seeing that increase each month, and that tells us that people are getting connected to the right resource at the right time for the right impact.
I have a couple of questions, probably for Joy. What does a mobile community response team look like, and is there only one? Like only one on at a time?
So I'm going to call on Jennifer Aford, who's our who supports the Alex. So right now, what we will be doing is we'll be onboarding with nursing as well as social work as well as peer support. But Jen can speak directly to what a team would look like.
Thank you so much, Joy. This is such a wonderful occasion to talk about the next steps for the community. So for the team, it will be initially one team. We will start small and build on early successes. We will work Wednesdays to Sundays from 10 a.m. to 2 a.m. That is all led by data intelligence that we receive, where the most calls being made to 911. And how Chief Neufeld said, after hours, the need for connection is quite great. We will have a 2-staff team in addition to the police that will be on site, so we can go to the calls and make sure that they get the support that they need. The second phase of this pilot will be 24/7, so something that we really want to get ready for and really make sure that we have all the ducks in the row to serve the community 24/7. We will have a nurse or a social worker, someone with more clinical training on the team. And then the second person will be someone with more hands-on experience, perhaps lived experience. We have done so much research with peer support and how folks that have struggled through difficulties and have come out the other side have this gift for connection, and we understand that this pilot can be successful if we're able to connect to the people, connect to our community. So with that dream team, as we like to call it, we will go out there and make sure that folks get the support that they need, whether it's during the day or after hours. We're incredibly excited to have the collaboration because we can't do it alone. The Alex is just one organization. And really work with our partners, Alpha House. We already have meetings planned to get together, and have been working very closely with 211, 911, and City, the wonderful officers that have been so helpful so far. So. I know we can shine as a city if we all come together as a community, and this is being announced today, but what I've seen in the past few weeks has been speaking to that already. So I'm incredibly excited, and I know with those kind of stakeholders and partners in place, this can only be really successful, and I'm really excited to be part of this journey.
Can I ask what happens, I mean, obviously calls don't happen during a confined time, so what happens outside of those? Do we go back to a default response that we had handled these kinds of calls with before, or is there some sort of mechanism in place to handle these types of calls moving forward? Like, as opposed to the mobile community response?
Thanks, Jennifer. I could try taking that one. And so, as Jennifer rightly said, the idea is that this is going to be a scalable community project. And so the ambitious plan is to go 24/7 within a very short period of time. However, given the nature of the relationships that we have with the ALEX and many of the community providers that are here, the idea is to adopt an integrated case management model. So whereas in the early days, officers may respond to these types of calls at 3, 4, and 5 o'clock in the morning, the idea is that they have another referral mechanism into the great staff at the ALEX who can provide that holistic, multidisciplinary wraparound services when the team is available.
Joy, question for you. Have you spoke to the vulnerable Calgarians about this, and what's their response been like? The people who would maybe be using this service?
So the report that was authored by the City of Calgary spoke specifically to the fact that people with lived experience were asking for a community-based response. And so this, when the request for a proposal went out by the city, the ALEX stepped up and said this is something that we would like to be involved in. At our community health center, we see people with lived experience day in and day out, and so we hear directly from them is that they would like a community-based response connecting to resources. I think what's the critical success of this particular project is that we've got staff who are connected with all different types of communities. Many up here have spoken to the fact that we're connected with, like there's hundreds of organizations, community-based organizations that provide mental health supports. Several of us provide specifics in terms of addiction supports. We have a rapid access addiction medicine clinic that falls also under Jennifer's portfolio. And so folks, then we can connect them back into community-based settings and maybe not necessarily have to go to acute care settings such as a hospital. And so folks are looking for, they don't want to be stigmatized, but they need help when they need help and they need a response when they call for a response. And so that's the critical piece about connecting all of these pieces.
And when does the program start? When can you make that first phone call?
Well, we could not hire until we made a formal announcement, so we are, which is really important, and so we are hiring in the next little bit. We've got some great staff internally who've already expressed a great desire to be part of this. Our staff teams are very excited about it. We've already been having good conversations with the fine folks at District 4 as well about how we can work in an integrated fashion together, and so we're hoping within the next few weeks we'll be able to get this off the ground.
I have a quick question for the mayor, only because this is a 12-month pilot. It's happening in one district. Obviously, if this is expanded to other districts, there's going to be more money that's going to be needed. Is the city prepared to step up and continue funding programs should this be successful?
So for the last 11 or 12 months, the city has been playing an important role as a convener, and I think it's significant that we did that. We did not come up with the solution on our own. We worked with our partners at places like the ALEX. We worked with the Calgary Police Service internally, so many different teams that we needed to consult with. Melanie Hulsker is here who helped us lead up this work, and we've got 211, 911. There's a lot of people who are at the table to talk about what to do, not to mention the community-based organizations who said, how do we help the community at the same time that we're helping the person in crisis? So we're absolutely committed to investing the money we need to. Even more importantly, we convinced our provincial colleagues that they needed to join in that investment. So we had an announcement about 2 weeks ago about mental health, homelessness, and addictions dollars that were being made available through our provincial partners. So the message has been clear. We have to collaborate to get this right, and we'll continue to do that.